Good morning, everybody. Hi, my name is Kina, and I'm going to be your host for today. Thank you all so much for being here. As a friendly reminder, this presentation will be recorded and uploaded onto our YouTube. While viewing the recording, there are features for closed captions and the option to choose the playback speed for the recording as well. And I will paste into the chat our links to our website, our YouTube, and Figure One for those interested in presenting. And today we have our Global Offsite Care Medical Director, Dr. Pecchia, who will be introducing today's presenter, Dr. Posper.
Kina, thanks so much. Great to be here. Welcome everyone once again, both those here live and also those viewing this on demand, the recorded version of it. So I'm the Medical Director of Global Offsite Care, Greg Pecchia. I'm trained family physician geriatrician, and also a faculty member at Western University of Health Sciences in California and Oregon, and have the honor today of introducing once again a good friend of Global Offsite Care and innovator in telemedicine. Over the past 6 years we've known him and before, and he's created in Haiti a practice model that has greatly benefited his patients and also telemedicine globally as a result of his efforts, lessons learned, and innovations along the way that he'll talk about today, and especially regarding his telemedicine center in Haiti, where he's served multiple clinics there and in other countries as well. Dr. Posper is a trained internist and also academician on faculty teaching medical students around the world, including here in the U.S. at University of North Dakota. Dr. Joey is also a telemedicine advocate and has developed a kit of digital clinical tools that he uses for his patient care and supporting that telemedicine model that we'll see this morning. He'll present the updated version of that kit, how it's used, and also its application in a low-cost, high-tech medical device-supported environment that is always evolving. He's also now incorporating artificial intelligence in the usage and application of these tools. So with that, I hand it off to you, Dr. Joey. Thank you again so much for being here with us today.
It's always a pleasure to be here. I feel right at home. You know, being with Global Offsite, we have so much in common, and I've learned so much, especially with intensive care, with the certification with Global Offsite. So I'm very grateful, and always a pleasure. One of the things that I want to start with, I want to show the people the challenges. One of the things that I always say that with telemedicine, if you can do it in Haiti, you could just do it about anywhere in the world. And that has been the case for me on the places where I go, whether it's Haiti, Burkina Faso, whether it's Ghana, whether it's Rwanda, any places that we go to, we are able to practice telemedicine, and Haiti was the guideline for me. So one of the things that I'm going to start with, I'm going to show you the state of Haiti that had pushed us to start telemedicine. So we're going to show you a clip about post-earthquake Haiti in 2010, okay?
When I started working for LifePaths, the earthquake hit right after, which was January 12th. And since I had been to Haiti before, Elaine and I decided that our first mission for LifePaths should be in Haiti.
Like I've got a saying, you know, if you're going to jump in the deep, does it really matter how deep it is? Because you have to swim.
We got together a team of physical therapists and we came to Haiti.
The travel here is 10 times worse than you'll ever find in Canada. And just knowing that Dr. Joey Posper was having to travel 3 to 4 hours to go to a 2-hour clinic and then another 3 hours back, it just seemed like a really ineffective way to provide health care. But it's the only way he can provide health care.
At first I was very overwhelmed, and then the second day I'm thinking, how can I as just one person do anything in Haiti? And then I met Joey and everything just seemed so much more hopeful.
Yeah, tonight at 7 o'clock, I'm coming by to see you. Okay? Okay, thank you. Okay, bye.
This is a place called Kaila Sante. When you translate that, it says the house of health. I see a lot of patients with post-trauma from the earthquake. Last week, I received at least 10 patients who were injured in the earthquake, and that was the first time receiving care at all.
I was here before, and I did go to mobile clinics with Joey for about a month, and it was the same routine every day. You're ready to be on the road by 6, so you can at least get to where you are at a decent time. There's at least a line of 50 to 60 people waiting for you, and you only have a limited time there because you have to go to another community right after.
This area is Belma 33, so a lot of these people are unable to walk to the hospital. So what we do, we try to bring the hospital to them. She has a rash, look like she has scabies. She's had it for about 2 weeks. It itches her a lot. Unfortunately, the creams that we want, we don't usually, it's a little bit hard to find. She's definitely malnourished, and now she's having some dermatosis around the lip area. So this is a typical case where I would love to have a day-to-day observation on her. Back home in the States, or a child like this would be hospitalized. It's beautiful. She has a 1-year-old. She still breastfeeds the child. She says when she spits blood. Although they know they should stop the breastfeeding, but because they don't have money to buy nourishment for the child, so she's among the people that we can send for an x-ray. The amount of x-rays that they do for us for free is close to between 8 and 10 per week. So we have to carefully choose who are the patients who need that the most.
The mobile clinic, the communities that we go to, they don't see anyone but Joey. So if it wasn't for Joey, a lot of these people would have to travel as far as 2 to 3 hours, and I can't imagine these people taking public transit or tap-tap or a bus to come. So really that tells me that these people have no other access to healthcare but Joey.
I know a lot of aides are coming to Haiti to help, to support in any sort of way, but me personally, no, I haven't seen it.
Mesdames, Marie-Josie. Ok, c'est Almeida, excusez. Ok, on va le mettre ça devant. Il y a une question de politique parfois, surtout en Haïti, parce que dirigeants, ça veut dire côté que vous avez viser pour être capable d'aider les gens, parfois c'est pas là que vous visez.
The first day I was overwhelmed. On the second day I was pissed off. I was just like, how can this be happening? And when we went to the orphanage, I broke down. I was very emotional. But I feel optimistic that we can actually fix a lot of things, and fairly quickly. Our idea is to bring telemedicine to Haiti so that doctors don't have to travel so far.
If we had telemedicine, this is what we could do. First, we could get an extraordinarily detailed close-up image of the eye. Now, that could then be viewed by an ophthalmologist, actually in better detail, almost than visual. And the reason is because not only can you use telemedicine for a straight visual, as we would normally, but we can also see it in the infrared and ultraviolet. Now, the time it took you to get here, you could have seen maybe 24 patients in that time if you were very busy. With telemedicine, on the other hand, you can see many more.
Having an ophthalmologist distance thousands of miles away, and just reviewing her, and that she could get her treatment without ever leaving this town.
I feel that what we have to be able to do is educate the client what they can do for themselves, and I think that there is a way to do it through telemedicine. we can have the patient assessed from afar and send a prescription down over the internet and have someone else here teach them and follow them as they do their program down here.
The telemedicine would definitely give him that freedom to see a lot more patients. He could reach out to patients in Jacmel, in Leicester, in St. Mark. He could see 10 times the amount of patients every day, not just once a week or once every 2 weeks. He could train people to be his healthcare aides, and they would be basically the hands of the doctor. Because Port-au-Prince is getting all the aid, but it's also very, very overcrowded, the key is the rural. We have to go out and build the structure for the rural people to be able to stay there. There's just three main components. It's healthcare, education, and government services. And all three of those things people seem to be traveling for. So our goal is to not come in and slap down some help and then take off. We want to make sure that they're...
So basically, this is how we started the first telemedicine clinic in Haiti. It was post-earthquake. What happened is that I couldn't travel, going from all these places, from one place to the other. Sometimes I would travel 6 hours to see patients for 2-3 hours and then travel back 6 hours. That's not an efficient way to really spend the time. And so we started the first telemedicine clinic in a place in Haiti called Leicester. When we started the first telemedicine practice that we had in Haiti, we were very limited. We had the internet, we had a digital stethoscope, not as complicated as that, but we had perhaps at the time the first Litman version of a digital stethoscope, right? So it's not like this one where, for instance, I could have the application wherever I'm at, where the telemedicine assistant puts it, and you could hear the patient's heartbeat at any place where you're at, as long as you have the application. At the time, we had to have the stethoscope. It was registered the sound, and the sound was sent to me, and I would get it in a minute or so. The heart frequency of the patient. Thus, with that, we started the first telemedicine clinic, and with that clinic, we started seeing a patient twice a week. We were seeing 52 patients a day on Wednesday and Saturdays, and it just grew, And in 2012, we received first prize for our telemedicine concept with the American Telemedicine Association. Now, what I want to say is that we started with the most simple form of telemedicine. What we had VC as the application that we're using for telemedicine. We had a digital stethoscope. We had a dermatoscope, and we had the video conference, and we trained our telemedicine assistants. They were trained for about 3 months, and they were trained to replace the doctor's hands, meaning that from a distance, I could visualize, I could see what my assistant were doing when I asked him, okay, let's see if the patient has angina. And I could see when they were doing the touches and so forth, and see if they do it correctly, and at the same time be able to evaluate the patient. And that was back in 2010, 2012. But since then, we have evolved a great deal with the different elements that we have for telemedicine.
Hi everyone, I'm at the University of Limonade School of Medicine in Haiti. It's part of the state university in Haiti. Because they have lost close to 40% of their staff, they've asked me to teach some classes for them while I'm over here. So what I'm doing some seminars for them, for the students, fifth year medical students. They're about to go into an internship. And when I get back to Rochester, I'll do a few more courses for them online. That's the way we have to get through it. But it's very exciting. The class went very well, and the students are very grateful.
How does telemedicine play a role with medical students? So it's the same thing. These medical students, they need clinical rotation. And because they lost a great percentage of their faculty staff, so they're not getting that. So one of the things that I help them with is that they still go to the hospital. I see the patient with them, and we use telemedicine. This is a hospital in Cape Haitian where they are seeing the patients. I'm using telemedicine, and we can monitor the patients together, which is a great clinical rotation. using telemedicine. And the great thing about this is that I get help from other specialists here in the US, you know. And so, for example, the last session we had an ER doctor and we had a cardiologist. So we're both, all three of us were assisting them with the different patients that they were seeing in their clinical rotation. Again, without this, they wouldn't be able to have their clinical rotation. So telemedicine, again, plays a great role. And this is not only for the students in Cape Haitian, but also those in Port-au-Prince and so forth. And again, that's the hospital in Haiti, and these are the patients that we have. We have all types of patients, and obviously not all the patients are within my range of practice. So I see the patients mostly in internal medicine and some family medicine patients. And again, because medicine makes it so easy to collaborate with other physicians around the world, we have a number, we grew a number, we put together a number of well over 12 other physicians, teaching physicians, who are able to help these students in Haiti. And because of telemedicine, where a great part of the school is still functioning, and we are now collaborating so that we could do the same with the hospital also, who lost a great percentage of the staff. And we have it within our project for global offsite also to collaborate with this particular hospital and university to provide them with telemedicine to be able to help them see a lot of their patients. And this over here, it's the same thing. This is my clinic in Haiti. That's the clinic that I run. It's the Telemedicine Center of Haiti. These are the people in the waiting room. And keep in mind, this is a place where we are very close to where the gangs are at. But the need for healthcare in Port-au-Prince is so huge. You know, people come. And we were thankful enough that the gangs, they did ask us not to close our clinic. So that's the safe haven for us as far as keeping the clinic open. But these patients that you are seeing right there, 50% of these patients will be seen via telemedicine by myself while I'm over here in Rochester. So just to let you know how effective it is. And these patients, they keep coming back with their family members and so forth because they find it effective. And the great thing about telemedicine, again, whenever I have a patient that I feel that I need help with, you know, I'll call a colleague and make an appointment with the colleague for us to see the patient together, whether this colleague is here in New York or whether it's in California, in Canada, wherever. So now that I show you the patients that we have, the scope of practice that we have and how used for telemedicine is, now I want to talk to you about the different kits that are used for telemedicine. When I wanted to develop my telemedicine kit, you know, I wanted something that was lightweight, something that can be very easy to transport to go from places to places. And I started working on it. Now, there's an institution called MedTech, and they invited me to see their telemedicine kit. And yes, it was impressive. It was impressive. It looked exactly like this. It could fold into a suitcase, which is just about the same thing that I'm doing. The only thing about it is that this that you're looking at, it costs between $36,000 to $42,000. So that's very expensive. It's very expensive, especially for a clinic to have in Haiti or in most places in Africa. That would be for the budget. So I continued with my project with the telemedicine kit that I'm developing, but I want it to be at a much lower cost than that. One of the latest things that I'm using is this right here, right? These looks like regular glasses. They look like your typical regular glasses, but they are not. They are Bluetooth glasses that can be record, that has video, and they are charged right here. And these glasses are made by Ray-Ban, right? But this is different. This is a new version that just came out from a group that is in India. They do the exact same thing that Ray-Ban does. The ones from Ray-Ban cost about $300, but this right here costs about $120. So what it does is that when the telemedicine assistant put it on, right, and the video call is on, so you could see everything that the telemedicine assistant is saying. So I find this very practical. I tried it while I was in Haiti, and I'm still trying it for my students over there. So a lot of times when we are, especially in disaster relief, whether you are doing triage or whatever you are doing, this becomes extremely helpful. It helps you see whatever they are saying, and you say, okay, let's choose this patient, and you could see the entire body of the patient, whatever they are saying. You don't necessarily have to have your camera focus in something exactly. Now, the video itself is not the best quality, but this is something that I will recommend you give it a try. It's Ray-Ban; they're the ones who make it, and I think it's a very useful tool. I'm still using this stethoscope that I bought about 2 years ago. It's less expensive than Littman. This is used by it's made by a company called Echo. So what you have is that you put it on the application on your iPad or telephone, whichever you're using, right? And as long as the application is on, whenever this person, your telemedicine assistant, is using it, regardless of where in the world the person is, as long as you have internet, whenever they are using it and you in the application, you can hear everything that they are hearing, you know? And that way you could tell if the patient have an arrhythmia or whatever the person had. And also, you can also record this. And this stethoscope costs less than $200, whereas Littman has one exactly like this in the $600 ranges. So I also make it my task to look around and see what is efficient, cost effective, and be able to create something, a cart that is too expensive for the average person in different countries, in Africa, in Asia, in Haiti, to be able to use. So the first thing that I want to talk about is on the right-hand side. The right-hand side, this one is my kit. Okay? The kit on the right-hand side, it folds and it goes into that suitcase right there. Okay? So what do we have in that kit? This is what it looks like. Okay? On the top, we have our iPad. I use a 13-inch iPad. I've been using this for about 3-4 years now. Okay. On the right-hand side, you'll see a blood pressure monitor. It's a digital blood pressure monitor. It's also with Echo, and so your telemedicine assistant doesn't necessarily have to tell you what the blood pressure is, but you will see it in the Echo application that is on your screen. And then here's something new that we're just using right now. And it's one of the new gadgets also. You see where it says portable automatic eye screener. So what this does, okay, you have the patient sit in front of you, right? And it could screen the patient eye. When it screens the patient eye, it'll be able to give you a prescription of the lenses that the patient will need. With that, you could prescribe eyeglasses for a patient with the eye screener. Before I got involved with it, it was tested by the different groups of people, and it got a 5-star for its accuracy. So while I'm not an ophthalmologist, but I can at least tell that this patient needs eyeglasses. So with this tool, it depends on the country where you are at. For example, in a lot of places in Haiti, in Africa, it will allow you to, you can, as a physician, do the prescription for the glasses. Here in the States, it's quite different. But this tells you the reading on the evaluation on the person's sight and whether or not they need glasses. I think this is fantastic. And so it is the renovation that we have done in our kit. Okay. And then we have the Butterfly IQ. As you have people who've known me, I'm a big promoter of the Butterfly IQ. They're not paying me for it, but it's just that the Butterfly IQ is a great item for your telemedicine because it's the size of your telephone. And not only that, you can connect it to your telephone, to your iPad, and you could send the images live to the radiologist if you cannot interpret them, and so that they could do the interpretation for you. And the beautiful thing about the Butterfly IQ, every 6 months there's an update of something new, of something that it's able to do. So I am one of the things that I would like to do is perhaps for those who have the butterfly IQ. I know we have some people in the Bahamas who had some issue with it. Is that we do a training, a complete line of training, so that they know how to use it properly. Because I have the impression that a lot of people who buys it, they don't know the full potential of how to use it. So I'm still going at that. It's the butterfly IQ. I'm still saying that it's a great tool to use. And I myself, I'm using it a lot, and I will continue using it. I have yet to see. I'm not saying that it's the best mobile ultrasound there is out there. There probably are a few of them. I'm sure I've seen at least 2 of them that are better than the butterfly IQ, but they are a lot bigger and they cost a lot more. The butterfly IQ price range from $2,200 to $2,600. That's the range price of the butterfly IQ. But anything that I've seen so far that comes close to it, that does what it does, with its simplistic application, will cost at least $4,000 to $5,000, and is a lot heavier. And in the bottom, we were able to work and find a mobile EKG. And that's what you have in the bottom. It's right in the middle. And with that mobile EKG, as you know, being able to do a electrocardiogram for a patient, whether you're doing mobile clinic, your patient care or whichever, that means that's a great deal. Okay. Another thing that we have, if you go on the left side on the image in the machine, you'll see where it says hemoglobin kit on the right hemoglobin kit. Yes, right around that. It's right below. There you go. It's in that. There you go. Right there. So what it does, it gives you the reading on the patient as far as the white blood cells, the red blood cells, and let you know if your patient is anemic or not. Gives you a complete reading of the hemoglobin. That is extremely, extremely helpful to have in your kit. And having that, so my patient is being seen by my telemedicine assistant. With that kit, I'll be able to know in less than 30 minutes what's the reading on the white blood cells and the red blood cells, which is great. I find it very effective and very helpful. Another thing that we're working on, we don't have it yet, and I've seen it. When I'm putting something in my kit, I usually get in touch with doctors who have used it, and so far, I've only had 3 doctors who have used it so far. It's not enough for me to come out here and give this a 5-star, or for me to even attempt purchasing it, or to put on my kit. It's a mobile X-ray machine. They have one out there. I hope as soon as I have it, as soon as I can test it, I have a doctor that is in Michigan that has one. I'm willing to drive over there to where he's at and test it and see how applicable it is. And I will let you know about it and probably do a little video shot and share it with you guys. And although in the bottom, what you have is a solar power bank. This is something you're always going to use. If you're in Haiti, you need a solar bank. Most of the places that you will go will not have electricity. And one of the things about this kit also, I designed this kit so that it could be applied for both places like the US and also places where you don't have a lot of infrastructure, where these can be used in places in remote areas. There's no electricity, remote areas where you go in the villages, and having this power bank that works with solar panels, it tells you that you will have electricity all day long. The power bank itself, it can keep all of these running with electricity for at least 8 hours, which is a good shift for us. So that's the kit that I have. So this kit, if someone, let's say, for example, I was asked to recreate a kit like that for an organization or a group, it will cost around between $12,000 and $14,000 to have this kit with everything that I've stated here, except of course the mobile extra machine. Now, the kit itself, it's quite special, and I will later on send a video for you because we are making a few changes in it to make it more applicable. At this time, it weighed 28 pounds, and we felt that it was too heavy. So right now, we're working on making it between 22 pounds or a little less to make it much, because the suitcase itself, it has wheels, but so that we can make it a lot easier to carry around. Now, the idea is this: when you open the suitcase, it has springs, a hydraulic system, and it just comes out to a standing position, which is about 5'2". And that's how it comes out, something similar to what you're looking at. Okay, so that's the kit. I find it very effective, and being able, it's really a mobile clinic of its own. And having a telemedicine assistant using these items, you have one of the most applied telemedicine kit. Now, one of the last thing that I want to talk to you about is AI. How artificial intelligence can be applied to your telemedicine practice. It is fascinating. It is revolutionary. That's all I can say. Because in my case, what I have done, there are different types of AI. It depends on what you are using. And you could put the AIs you could put your electronic medical record system within your AI, and it'll make all the evaluation. It'll put everything online for you. And also with the AI, I'm able to know, the range of my patients. Let's say, for example, I'm seeing 20 patients. And with these 20 patients, I have 8 of them that has similar symptoms, right? So you could have an AI, you could have your AI let you know that this is the 8 patients that you have with the same symptoms. And now you could start evaluating, okay, do I have an outbreak? Is there an outbreak out there? If we had this, it would be a lot easier for us to know that we're dealing with the cholera outbreak when it came back in 2012, 2014 in Haiti. And that would have saved a lot of lives, because it took us a while to realize, hey, we have a cholera outbreak. It helps with that. This is the last gadget that I will talk about. This is a water ergonomic detector. This is being developed by Dr. Leon Posper. We share the last name because that's my older brother. He has a PhD in environmental and biomedical engineering. And we are testing this, and I'm extremely excited about this. What it does, when you go to a region, okay, you can test the water. With that machine, you can test the water, and it's able to tell you the state of the water and identify a lot of diseases, a lot of microbes, a lot of viruses. Thus, with this, whether, for example, you go to an area, you're doing telemedicine or you're doing mobile clinic, you want to test the water in the river. You want to test the water in the lake. You want to test the drinking water that they're using in the well. You want to test the water in different housing. And this will tell you the state of the water, and that itself will tell you a great deal about that area, the environment, and the state of health. And this is something that you would later on share, whatever the outcome is, with the Minister of Health, and having that in your cart. So this is something that we're going to have in our cart in the next month. And we've tested the machine. My brother, he has tested the machine, and it's very effective. And I'm very much looking forward to having this in our system. And I intend to send one to Global Offsite. They could test it themselves and let us know what they think of it. And so it is now 11:42. I'll leave the rest of the minutes for any questions that people have and anything else that they want to know about the kit itself and our telemedicine practice.
Fantastic. Thank you so much, Dr. Joey. That was somewhere between amazing and awesome. Really appreciate that.
Thank you. It's always great to be with you guys.
Yeah, this leads also to a lot of questions. So I'll leave it open to anyone in the audience to start, and then I have a few.
Anyone who wants to know more about the telemedicine kit that we have put together, please feel free. You could give them my contact information. And also, we also have developed, that's something that I want to talk to you about at a later time in a private conversation. We have also developed our own electronic medical record system that is adaptable to that kit.
Okay, great. Thank you for sharing that with us. So, any questions amongst the audience?
Hey, Joey, what is your contact information?
Okay, I'll let them share that with you in the chat group.
Okay.
Yes, and I'll provide my telephone number, and I'll let them do the rest.
So do you remember when the Rotaractors came, Kenwood, Cartwright, in 2015, and they brought telemedicine? Yes. They worked with Dr. Good and Michael Cook, and they brought telemedicine to Haiti.
I remember, yes.
Yes, so where is that laptop? Where's the equipment? Do you know what happened to it?
Well, the equipment is still there. Unfortunately, some of it is outdated, but the equipment is still there. The laptop is still, it's at the Telemedicine Center of Haiti. It has been fixed a few times. It's not, as in the state that we would wish for it to have, but it was very useful for quite some years.
Well, since we last worked with you, we now have a group called Global Rotaract Alum. And there are 12 of them, and they go to the International Rotary Convention every year at a telemedicine booth. And their only project is telemedicine. And they just have to be in touch with you. That's why I want your contact information. Yes. I've been texting him the whole time we're on here saying, get on Grand Rounds. Yes.
Yes, please do. And feel free to share this video with them because it's been recorded.
Yeah, how can I get the video? Can you send me the video? Sorry to ask you.
Global Offsite. You could talk to Global Offsite, and they're the one who will be in charge of that. And I wrote my number in the chart for you.
Oh, you did? Okay.
Yeah.
I remember you from before. Nice to see you again.
Yes, it's great seeing you. Oh my God, I didn't even know you were going to be present in this presentation.
I know. I didn't realize it was you. I would have made everybody come.
Yeah, so one of the things that is so significant for us with telemedicine is that Haiti is in a state of emergency again, not because of natural disaster, but I know if you have heard in the news that about the gangs have taken over and so forth. And people are devastated, and our clinic is still functioning thanks to telemedicine.
I love that story that the gang said okay to the clinic. That's wonderful.
Yeah. And unfortunately, it's with a very heavy heart that 2 months ago I lost two friends in Haiti. Oh. Yeah, I think you've heard about the 2 Americans who lost their lives.
Yes. They were your friends?
Yes, Natalie and so we had planned to establish a telemedicine clinic for their school and their orphanages because they liked the idea so much. And one of the things that we spoke about and that we wanted to do, I know we'll probably take some other time, but I wanna talk about this. So we wanted to put telemedicine in the school. We tried that before and it worked perfectly well. So the idea is that put telemedicine in one of those schools, right? And when a child is sick, the child will still come to school and be seen via telemedicine. And we, the doctor who's on the other side, will decide whether or not that kid should stay home, should go back home, right? And or stay in school. And have a small pharmacy in the school where the child will give in medicine to. And in that project that we did, it was a pilot program that worked very well. We trained the teachers. The teachers were trained to become telemedicine assistants for 3 months. And it was a great pilot project. Unfortunately, we didn't have sponsorship to keep it going, but it was a great project. And that's something that they wanted to do in their orphanage.
Oh, yeah, that's terrific.
Yeah.
Well, at the Rotary International Convention in Singapore just 2 months ago, we had 12 Rotaractors that had the butterfly IQ. And they knew just enough how to use it. When people came by the booth, they put it on their neck, arms, and that came to life. It's fun, and young people can learn it, and it brings.
I'm telling you, I think the manufacturers of butterfly, they should hire me because I've had at least over 100 people buy the butterfly IQ.
Yes.
And, yeah.
And I could see them using it in schools too. But anyway, I'm sorry, everybody else. We'll get back to you.
Okay. Any other questions?
I have one.
Yes.
A couple of logistical questions, and that are important in this conversation. One that comes to mind is in remote, underserved areas of the type that you're accustomed to serving. How do you manage the internet connection issue? Right, you've got the power issue addressed, the internet issue, and
internet is huge. You have to have internet. You know, and that's what telemedicine is. That's probably the number one tool. The number one tool is to look for good internet, because you could actually do telemedicine with just video conference if your telemedicine assistant is trained to apply the hands well. I'm just but you need much more tools than that, but I'm just saying. So in Haiti, fortunately, because of two telephone companies, Digicel and Natcom, those telephone companies. So I have my telemedicine assistant. I put internet. I pay every month to have them have internet on the telephones, and they use the telephones as Wi-Fi's. Mm-hmm. And guess what? And one of the platforms that we use the most, because we're very limited with our fundings, is WhatsApp. We use WhatsApp a lot in Haiti to do telemedicine, because using VC or these other applications are somewhat expensive. But having those tools with this kit, you could perfectly use WhatsApp and use and have your own electronic medical record system. You put them, you have everything in their store in the cloud, and have an AI that will organize everything for you in just about 2 minutes.
Great.
Yeah, and so the other form of there's only three, not two. The other form of internet that you could have also is Starlink. Starlink, it's not that expensive in Haiti right now. I don't know if it's expensive in Africa, and it works very well in Haiti. I have an organization where I'm on their board in Haiti. It's called FIDA PCH. They're using it right now way over the mountains where there's no signal at all, and it's working very well. And your last option, it's a little expensive. It'll probably cost you somewhere like $200-something a month, is to have a digital phone, a satellite phone, with the internet service, and you could use that Wi-Fi to put in your kit.
Great.
Yeah. We could say for sure that Starlink and the satellite telephones are the most secure, because you could buy the kit for Starlink, go anywhere in the world with it, and geographically give the location, and you'll be able to have internet as long as you pay the monthly fee or whatever.
Mm-hmm. Okay.
Yeah.
Well, yeah. Offline, we have actually some history with Starlink and some contact with them for applications like this. And and that leads to the next question, whether it be the Starlinks of the world or other internet service providers and equipment providers, how does it get paid for? Do you, as either your nonprofit or your regular medical practice provider in this difficult environment, are they helping out with decreasing financial pain and the price of
Unfortunately, that's not the case. Unfortunately, we didn't get any discount, if you want to say, from any of these institutions. We have a 501c3. For example, for my institution, it's called Streams in the Desert, and I'm not going even to share with you what our budget is. It's so minimal. You know, myself and a good friend of mine named Dr. George Larkins. He's the major contributor that keeps everything going on. So it's a testimony also to what you could do with a limited amount of funding. Although we do have bigger projects that one of our goals is to have a mobile hospital in Haiti with all the telemedicine component, and where we could bring the hospital itself to different areas of the country when it is needed.
Great, thank you. And we'd love to continue the conversation thereafter, especially with Global Offsite Care's experience and resources. So we'll look forward to that conversation.
Of course.
What happens when, let's say, you're in the middle of a telemedicine, setting up a live telemedicine encounter, and your system goes down, or that you've got a sick patient and they need help, but you have no live internet connection? How does the offline environment work?
Well, it happens. When that happens, my recommendation is to stay online with your telemedicine assistant on the telephone until the line comes back on. In the meanwhile, have that person video everything they're doing. So again, this is where this will come very useful as well. You know, so let's say you lose your line, but with this, your telemedicine assistant can still do the videotape or record everything that is happening while you're talking with him. And later on, when it comes online, he could send it to you. But in the meanwhile, the best thing you could do is to stay online with your telemedicine assistant and by the telephone.
Great, great. And you mentioned also, back to the importance of the internet connectivity, when using cell phone networks and using a phone as a hotspot, is that enough bandwidth to actually support a live telemedicine encounter in your experience?
It is. At least that's the other thing. All these equipments that we are using, these equipment, for example, in the kit, they are wired via Bluetooth. The information is taken from them and go to the AI and thus your networking. But they themselves, they don't require internet. So therefore, you only have just your iPad using the internet, because all the other applications that you're using, they're on your iPad.
Right.
So
right.
Yeah. So no, it doesn't take much.
And on your hub device, like the laptop that the Bluetooth devices are connected to, if that is actually, if it's connected to internet with cell bandwidth, let's say that it's getting its internet from a cell phone, right, a hotspot, can it actually function in real time?
Well, yeah. For example, let's say I have the Echo application on my iPad, right? So it's the telemedicine assistant who's using the iPad. I'm just in front of my iPad, and when he takes the person's heartbeat, right, it records. I'm listening to what he's listening, right? I can choose to record it and put it in the patient's file, right? And that's something that I love using. But it doesn't really use that much width as far as the internet.
Mm-hmm. Great, right. Okay, really appreciate those answers, and
it's always exciting to talk about telemedicine, because we are a testimony that how telemedicine has kept clinics open in Haiti, have been being able to provide for patients via telemedicine. We go to Africa. I'm going to Ghana in November, and I'm going back in December, and it's the same thing. We're going to see those patients. We're going to do a mobile clinics, see those patients, and we're going to do follow-ups via telemedicine.
Great.
Yeah.
So something also that perhaps before your next visit with us, that would maybe be able to collaborate on a platform that we've been using and that you've seen for those in the audience promoting, using Figure One, which is a Canadian-based company that has for years provided a platform for sharing cases. So posting cases, images, etc. That actually,
I know about that.
Yeah, a Toronto-based company, and we'll share that with you, maybe talk about that offline as a way of collaborating for not only specialty opinions and input, but also for sharing with medical students and residents for augmenting their clinical experience, sort of a virtual clinical rotation site, if you will.
Yes. And that, like I said, with my students over there in Limonade in Cape Haitian, that has worked great. It's fantastic.
Yeah. So again, I really appreciate you helping us out today with walking us through the components of each of the challenges of telemedicine, most of which you appear to have addressed effectively, and are a testament to stick-to-itiveness and innovation, and really are honored and happy to be able to have you here today. So
thank you. It's always a pleasure, and I'm always available to Global Offsite. You guys mean so much to me, and I've learned a lot. Your certifications meant a lot to me.
Thank you for that. Appreciate it.
Okay.
Well, if we have no other questions, I'll hand it back to Kina to close, and thank you again.
It's a pleasure.
Thank you so much, Dr. Pecchia, and thank you so much, Dr. Prosper, for the amazing presentation. And thank you, everyone in the audience, for your continued interest and participation in the Global Grand Rounds. Our next Grand Rounds will be on September 11th at 8 a.m. Pacific Time. And if you're interested in presenting, please reach out to me. I will put my email, our links to the website, YouTube, and the links to Figure 1 in the chat. Once again, thank you so much, and we hope to see you again at our next Grand Rounds.